This is Hello Healthy, a Dignity Health podcast.
Welcome back to Hello Healthy. I'm your host, Caitlin White. And today we have on the show Dr. George Schuler, the Chief Medical Officer for Dignity Health Mercy Medical Center in Merced. He's here to debunk 10 myths about the COVID-19 Pfizer and Moderna vaccines. So, Doctor, I'm going to read off some statements about these two vaccines, and you'll tell us why these are wrong. So starting off with the first one here, the first myth is, I had COVID-19, so I don't need the vaccine.
So there's several health risks associated with COVID-19, and reinfection is possible. The vaccine offers additional benefit, and this is important. It's the additional benefit. And so the CDC recommends that you get the vaccine even if you've had a COVID-19 infection. Also keep in mind that COVID-19 infection gives a variable immune response depending on severity of illness, whereas the vaccine gives a more consistent, predictable degree of immunity. So getting the vaccine gives additional benefit over having the infection.
The second here, I can get COVID-19 from the vaccine.
That's absolutely not true. The only way to get the infection is to be exposed to the live virus, and none of the vaccines contain live SARS-CoV-2 virus. They only contain viral proteins, all of which are non-infectious.
I will be protected from COVID-19 after the first dose, so I don't really need to worry about the second one.
It's really important to get the second dose in order to get the most protection the vaccine can offer. You won't get the full duration of protection from the vaccines until 1 or 2 weeks after the second dose. So it's important to get the second dose for the full benefit of the vaccine, not just the total duration of the protection that the vaccine has to offer, but also the degree of efficacy that the vaccine has to offer.
How about plainly the vaccine isn't safe?
So there have been large clinical trials with diverse groups of individuals for the COVID-19 vaccines, and these were set up to make sure that they meet safety standards. There are absolutely no significant safety concerns identified. We would not be administering the COVID-19 vaccine unless the FDA had determined it is safe and effective, and they did. They decided this by way of a panel of experts who then went ahead and recommended that we proceed with authorization for the vaccine's release to the FDA itself.
What if I have allergies? Should I get the vaccine?
So people with severe allergies who have experienced anaphylaxis in the past or allergic reactions to vaccines should absolutely talk to their doctor about whether they should get the COVID-19 vaccine. If you've had a severe reaction or an anaphylactic reaction to the first dose of the COVID-19 vaccine, we do not recommend that you get the second dose. Having said that, when we vaccinate people, the vaccine clinics, they are set up with trained nursing staff and the equipment and medications on hand to deal with any unexpected reactions like you may have read about in the news. So it is still very, very safe to get the vaccine, even should you develop an allergic reaction or have a history of allergic reaction.
Here's one I haven't seen before. A COVID-19 vaccine will alter my DNA.
Absolutely not. So it really helps if you understand how the body's and the cellular mechanisms for creating proteins works. But even if you don't, mRNA is not genetic material. So these vaccines are mRNA vaccines. The active ingredient, if you like, is a molecule called messenger RNA that codes for a certain component of the SARS-CoV-2 virus, namely the spike protein, which is expressed on the surface of the virus. And all this messenger RNA does is it uses the cell's own mechanisms for producing this protein and moving it to the surface of the cell. It never goes near our DNA. The messenger RNA has its effect outside the nucleus where our DNA is located, and so it never has the opportunity to alter our DNA, nor could it. It's just not how it works. And what's more, messenger RNA is unstable enough that once it's been used up by the mechanism within the cell to create that spike protein, it gets degraded, it gets destroyed. So the cell's own mechanisms for deactivating our own messenger RNA also deactivates the vaccine messenger RNA. There's just no opportunity. It just doesn't work that way. Your DNA is perfectly safe.
So I've got the vaccine, both doses. Now I can take off my mask and run and go hug my friends, right?
Only if you want to give them COVID. So this is something that we really do need to focus on. It's very important to understand that the basic infection prevention protocols that we have in place, the guidance and recommendations for preventing and mitigating the spread of COVID still apply. That includes wearing a mask, washing your hands, and maintaining social distancing. So while the vaccine will offer protection to the vaccinated person, you can still spread the virus to others. And it's actually a concern that's been discussed in the scientific community. We are not sure to what degree you can still spread the virus, but I think you need to take it for granted that you can. And so it is important to continue to wear a mask, wash your hands often, and stay at least 6 feet away from others, even after you've had the vaccine.
Now, what about the myth that the vaccine was rushed?
So years of science and innovation have paved the way for this vaccine to be delivered quickly. 2 reasons the vaccine was developed quickly are because messenger RNA vaccines can be produced faster than other vaccines, and this is not a new technology. We have been using messenger RNA technology in the treatment of cancers for decades. And researchers used existing clinical trial networks to begin conducting the COVID-19 vaccine trials as soon as possible. So the infrastructure was there to quickly get the vaccine brewed up, if you like, manufactured, and then get it out to the clinical trial participants as quickly as possible.
Now, I'm seeing people with comorbidities or people over 65 getting the vaccine. What if I'm young, I'm low risk? Do I have to worry about getting it?
It's still possible to contract and infect others with COVID-19, even if you don't experience any symptoms of the virus. So it's important to get the vaccine so that you don't unknowingly infect a vulnerable person around you. That applies to young people as well. And let's not forget that one of the most frightening things about COVID-19 is the randomness with which it can cause severe life-threatening disease. And even at our facility, we have had such an example of a young woman who is now, albeit slowly, somewhat recovering from COVID, and may still need lung transplant as a result of the long-term damage done to her lungs by COVID-19. So you should not take it lightly, and it is really important that everybody that qualifies for the vaccine get the vaccine to protect those around them and themselves.
Absolutely. And wrapping up here, let's talk about pregnancy. If I'm pregnant or if I'm planning to get pregnant soon, should I get the vaccine?
So pregnancy is one of those conditions where we always caution expectant mothers to not do something. But in this instance, pregnancy does not necessarily prevent you from getting the vaccine. You should talk to your doctor about what's best for you. Current recommendation is actually that even if you're pregnant, you are safe to get the vaccine. And let's not forget about the nursing mother, too. You've just had your baby or you're still nursing. It is also safe to get the vaccine. There is no indication at this stage that the vaccine harms the unborn fetus, and there's no indication that the vaccine harms the nursing infant.
Well, thank you so much, Dr. Schuler. I'm glad we cleared up some of these myths, and hopefully we get even more people out to their vaccine sites once their phase is up. For a list of community vaccination sites in your area, please visit your local health department's website. You can also find more interesting and informative podcasts in our podcast library, and be sure to share them with your loved ones. This has been Hello Healthy, a Dignity Health podcast. I'm Caitlin White. Stay well.